Hello everyone. So today I am going to talk about barrier methods of contraceptive. These are the methods that prevent the sperm deposition in the vagina, or they prevent sperm penetration through the cervical canal. The objective is achieved by mechanical barrier and by the chemical means, which produce sperm immobilization, or by combined means. And there are different types of barrier method, like the mechanical, and which include in male the condom, in female the condom diaphragm, cervical cap. The chemical barrier method, which include vaginal contraceptive like creams, delphine cream, non-oxynol, that is also non-oxynol 9 to 2.5%, and foam tablets, aerosol foams, sponge today. So these are chemical one, and the combination of the combined use of mechanical and chemical method. So let's talk about condom, and condom in from the condom of the male. So condoms are made of the polyurethane, they are lamb skin, or they may be made of latex. Polyurethane condoms are thinner and suitable to those who are sensitive to latex and latex rubber. It is most widely practiced method used by the male, and in India, one particular brand is widely marketed as Nirod, and and the efficacy of condoms can be augmented by improving the quality of the product and by adding spermicidal agent during its use. The protection against sexually transmitted disease is an additional advantage of condom. Occasionally, the partner may be allergic to latex, therefore, it should be neither too tight or not too loose, and the reservoir should be left at the tip to retain the ejaculate. While using condom, the adequate lubrication should be used, and the women who are at high risk of HIV infection should not use monoxynol 9 spermicide, as this may increase the risk of HIV transmission. So condom is a suitable method of contraceptive for those couple who want to space their families, who have contraindication to use of oral contraceptive or intrauterine device. These are also suitable to those who have infrequent sexual intercourse. And talking about female condom, it is a sheath made of a polyurethane, which lines the vagina and also the external genital tract. It is 17 cm in length with one flexible polyurethane ring at each end. So we will see figure. So this is female condom. It has two ring, and inner ring is closed and smaller. It is smaller compared to the outer ring. Inner ring is inserted at the apex of vagina, and the outer ring remains outside. It gives the protection against STI, cytomegalovirus, HIV, hepatitis B, and also the pelvic inflammatory disease. It is expensive, and multiple uses can be made with washing, drying, and with lubrication. So what are the uses of condom? As an elective contraceptive method, as an interim form of contraception during pill use following vasectomy operation, and if an IUD is thought lost until a new IUD can be fitted. During the treatment of trichomonial vaginitis of the wife, the husband should use it during the course of treatment, irrespective of contraceptive practice. Immunological infertility, male partner to use for 3 months. So that was all. And the condom have other advantages, like they are cheaper with no contraindication, no side effect. They are easy to carry, simple to use, disposable. They protect against STDs like gonorrhea, chlamydia, SPV, HIV. They protect against PID. They reduce incidence of tubal infertility and ectopic pregnancy. The protection against cervical cell abnormalities, useful when the coital act is infrequent and irregular. And what are the disadvantages? They may accidentally break off or slip off during coitus. Inadequate sexual pleasure. There can be allergic reaction, and to discard after one coital act. They have to be used again and again. So what are the precautions while using the condom? And we have to use a fresh condom for every act of coitus, and we have to cover the penis with condom prior to genital contact. There has to be create a reservoir at the tip to withdraw while the penis is still erect, and the grasp the base of the condom using while during withdrawal. And the failure rate of condom is 15 women here, 100 women here. So that is all. Now we will talk about diaphragm. Diaphragm is an intravaginal device made up of silicone cup with flexible metal or spiral ring at the margin. This is diaphragm. It is intravaginal device made of a silicone cup with flexible metal or spiral spring length and margin. Its diameter varies from 5 cm to 10 cm. It requires medical or paramedical personnel to measure the size of device. The largest size should be used without any discomfort or undue pressure. Kaya is FDA approved, and it is a single dose diaphragm that does not require fitting by medical person. So the diaphragm and cervical cap. The diaphragm and cervical cap may also reduce the risk of cervical cancer. It should completely cover the cervix. As it cannot effectively prevent ascent of the sperm alongside the margin of the device, additional chemical spermicidal agent should be placed on the superior aspect of device during insertion so that it remains in contact with cervix. The device is introduced up to 3 hours before coitus and is to be kept for at least 8 hours after the last coital act. Ill fitting and accidental displacement during intercourse increases the failure rate. The advantages of diaphragm is that it is cheap, it can be used repeatedly for a long time, it reduces pelvic inflammatory disease, STIs to some extent, it protects against cervical precancer and cancer. The disadvantages of diaphragm is that the risk of vaginal irritation, abrasion and UTI are there. It is not suitable for women with uterine prolapse. Now we will talk about vaginal contraceptive. Spermicide are available as vaginal foam, gel, cream, tablet and suppository. So this is about spermicide. These are vaginal contraceptive. They are available as foam, gel, cream, tablet, suppository. Usually they contain surfactant like non-oxynol 9, octovaginol or benzalkonium chloride. The cream or gel is introduced high into vagina with the help of applicator soon after before coitus. The duration of maximum effectiveness is usually less than 1 hour. The foam tablet are to be introduced high into vagina at least 5 minutes before intercourse. In isolation, it is not effective, but enhances the efficacy of condom or diaphragm when used along with it. So there may be occasional locally allergic manifestation in either vagina or vulva. And we can also use spermicide microbicide combination that supports a natural defense, maintaining the acidic pH and act as a microbial also. They are controlled by male. So that was about spermicide. And next is about vaginal contraceptive sponge, that is Today, also known as Today. It is made up of polyurethane impregnated with 1 gram of non-oxynol 9 as spermicide. Non-oxynol 9 act as surfactant which either immobilize or kills sperm. It releases spermicide during coitus, absorbs ejaculate and blocks the entrance to the cervical canal. The sperm should not be removed for 6 hours after intercourse, and also it produces lesion in the genital tract when used frequently. The lesions which are associated with increased risk of HIV transmission it can produce, and the sperm should not be used during menstruation or puerperium. So that was our barrier method of contraception. Thank you. We will come up with next topic in a new video. Thank you.